So this is episode 141, and we are talking about alternative therapies this week. Just like basically different options that are within the holistic wellness world that are out there that a lot of us don't know about, that could be options to help support your healing journey. So I just wanted Dr. Carmen to just kind of just touch on all the different, not all the different ones, but touch on some of them, like when we need it, like, and just a little bit of base knowledge. So if you're out there searching for that, you at least have some foundation.
Sure. So the I don't know, world of alternative therapies, I think a lot of this kind of shows how we're always trying to use science, right, to learn different aspects on how to heal our body, right? I often talk about food and supplements because I'm talking about, how can we build the foundation? But are there things that we can do kind of in the interim to really like jumpstart or kickstart things or, offer support in different ways to our body? And the answer is yes. There's a whole line of them, a whole list of them. And so let's see, how I start. We're going to start from the least invasive to the most invasive, okay? Because they really kind of run the gamut, okay? I'm going to start off with hyperbaric oxygen therapy. So because not all of these therapies have a lot in common. Some of them do, but they don't all have a ton in common. But so hyperbaric oxygen therapy is the use of a chamber, and you're changing the pressure of the atmosphere that you're sitting in. So out in the world, we're at 1 atmosphere. In a hyperbaric oxygen chamber, it can go anywhere from 1.3 in like a mild hyperbaric oxygen therapy to 1.5, even 2 atmospheric pressure within the chamber. Now, the higher the atmospheric chamber, it needs to be done in a medical facility. So sometimes even 1.5 or 2, it's a hard-sided chamber, and that needs to be done by a professional that, is very well versed in hyperbaric medicine. Okay. But essentially what's happening is you're increasing the pressure. Oftentimes you're also increasing the oxygen concentration in that chamber. But when we increase the pressure, what that does is that increases the oxygen molecules, the oxygen molecules in your blood. So it increases the red blood cells binding capacity for oxygen molecules. So the way that I like to describe this to people is hypothetically, think each red blood cell, right? If you think of it a lot like a bus, it has so many seats for so many passengers. It brings iron, right? It brings water, it brings other nutrients around, what also brings oxygen. So say that it has 6 seats for oxygen. The average person who goes around breathing our ambient air that's 16 to 21% oxygen may only have 2, 3, 4 seats filled with oxygen. So that what hyperbaric does when it increases the pressure, it creates a higher affinity so that we're really filling up that red blood cell bus, if you will, with like, maximum capacity, 6 molecules of oxygen in our hypothetical situation. Mm-hmm. So the more oxygen that's floating around in our blood, right, the better our cells are going to function, right? So oxygen is needed for repairing, for regeneration, decreasing inflammation, killing. We know oxygen kills viruses and bacteria. Oxygen is also can squelch free radicals, right? So it can be a little bit oxidizing, but it can also be an antioxidant in the same capacity. And so everybody needs oxygen, right? Like our body needs oxygen. So hyperbaric therapy can be really beneficial for everybody across the board. There are some contraindications. So wherever you're looking for hyperbaric therapy, make sure to talk with the practitioner, or there are some physical therapy offices or even spas that offer hyperbaric, and just make sure that it's not contraindicated for any situations that you have. Yeah. It's usually pretty benign. You sit or you lay down in this chamber for about an hour. That pressure changes. You want to wear cotton or loose, natural fibers, because that just reduces kind of that toxicity exposure, if you will. So, yes, so that can be very beneficial for everybody. Now, the trick with oxygen therapy is that you have to be a little bit consistent about it. All right, so we can see changes, and technically this is with any therapy, okay, even supplementation to a certain extent, is that the goal is to provide the body with in this case, oxygen, to help to correct a situation. But if the chronic inflammation or if the exposure is consistent or regular, or more than what that oxygen load is, then it can be in this okay, where you feel great after the therapy, you've moved 2-3 steps forward, but that chronic inflammation, right, or exposure is moving you back 2 or 3 steps. So it kind of feels like you're kind of breaking even. So often with hyperbaric or any of these other therapies, it's being consistent, right? And you'll probably have to do the therapy more than once.
Gotcha.
Okay, so let's see. Red laser is another one that's becoming really popular. This one's a little bit tricky because there's a lot of generic red lasers, and then there's the original red laser therapy that has been researched and is used often. So red laser therapy actually, I believe, originated in the veterinary world. And then now we've moved it over to humans. And so they were using red laser therapy on these $1 million racehorses to stimulate healing, decrease inflammation, right? So if they had an injury, they were using this, when we get any kind of injury, we're going to get some inflammation, right, to that area. But mostly they were working on horses with bum legs and they didn't want to put them down. And so they were, looking to see what we could do to repair things so that either they could have another reproductive cycle or, get them back on the track, essentially. So that's where a lot of the money came in for research and using that red laser therapy. So they were using red laser and kind of infrared together. And so there's some really good research around that in the veterinary world, right? Mm-hmm. Well, horses are mammals, we are mammals, right? Mm-hmm. Our tissue is very similar. So then they started applying it to humans. Mm-hmm. The trick is that now, and so they advertise it around joint pain and inflammation around, injuries and things like that. But you can find red laser mats, yeah, that you can sleep on, you can lay on. They have saunas that will have red lasers in them that promote that anti-inflammatory piece. Now, if it's a red laser with infrared, you want them to specify how deep that red laser penetrates the skin, okay? Because there's red laser. I mean, I can get a light bulb and put red, paint on it, and then, okay, great, now I have red light, right? So there's different, when you want them to specify what is this frequency of that red light. So they should be able to tell you how many, the nanometers of that red light. And they should also be able to tell you what is the depth of the penetration of that red light. And the way that technically it works is that it stimulates a little bit of a detox process within the lymph vessels, right? So when we're talking about inflammation and the immune system, the lymph system is a big part of that, of our immune system, right? That's how our immune cells often get from point A to point B, is it uses the lymph as the highway. And so if we're using red laser to stimulate the lymph system and kind of detox that way, we can reduce inflammation a little bit faster. I have seen red laser be really beneficial in more like with the like targeted red lasers that you use often like in a single, like pointed at a single area at a joint, or like the liver, or right, like the pancreas or something like that. So, but you, like I said, you can also do kind of the mats.
Yeah. Okay.
So let's see. Yes, yeah, I've seen like spas will offer, you know, mats, or like massage therapists will have like a laser mat that you can lay on. Okay. The next is PEMF. PEMF stands for pulsed electromagnetic frequencies. I see this offered in a lot of doctors' offices, chiropractors, some physical therapists, spas. And so it's not invasive. It's a machine that releases that pulsed electric frequency. Okay. There are different kinds, but usually it's I don't know what you call that. It's a round piece that usually either they will, if you're laying down, they place it on top of your body. They may put it on top of a particular body part. And it pulses electromagnetic frequency. So it kind of feels like it's vibrating, like it's not uncomfortable, but it kind of just feels like it's vibrating. Yeah. And so sometimes practitioners will use it, like I said, on specific body parts, or they will move it if they're doing a whole body treatment, or they'll like put it over the liver, or they'll put it over, like the chest and the thymus, depending on what they're trying to target. The idea is that electromagnetic frequency, and the machine has a dial where you can choose what frequencies, and usually they should be adaptive. If they're doing a frequency for autoimmune, if they're doing a frequency for cancer, if they're doing a frequency for inflammation or arthritis, or diabetes or fatty liver, or any chronic condition, technically they can kind of set that frequency. Okay. And the idea is that frequency helps to stimulate the cells to be more efficient, right? So, and to kind of clean up the cells, if you will. So one way they can do that is that it can stimulate this like autophagy that we've talked about, but that electromagnetic frequencies, there is actually a lot of really good science about magnetic frequencies in relation to certain medical conditions. So that's a neat one to kind of try. They do have models that you can purchase and have at home. I would say try it in a practitioner's office first before you go and purchase one on your own. But that one again, because you're doing those pulsed frequencies, it's going to take multiple treatments. Okay. Now sometimes after one treatment, people will, experience less pain. They will feel better. But oftentimes you have to do that multiple times as well. Okay. So that is PEMF. Okay. Those are all what we consider kind of non-invasive ones. Okay. So cold therapy, cryotherapy. I don't know if you guys are familiar with this. So cryotherapy is, I've seen it in wellness centers. I don't know if I've seen it in spas, but I've seen it in wellness centers. I've seen it in physical therapy offices, chiropractor offices, pain clinics. And it's a huge tank. It's a huge tank that is filled with liquid nitrogen. And depending on where you go, they'll tell you like what to wear, what to dress. They'll, tell you to bring specific like wool socks because you want natural fibers, or like a bathing suit. And you step in, and they can change the temperature, but usually the temperature is like -degrees. And you step in, and you're there. You want to know how they do the procedure, because usually they start people off with seconds. And depending on the temperature, right, you only want to be in there for seconds. They lower it down to 0 degrees or 32 degrees. You could be in there for just maybe 2 minutes. Most cryotherapy is not longer than 3 minutes. And so if it's -degrees, you don't want to be there longer than 3 minutes, but usually they'll start off slow and kind of work you in. So it's a very short therapy, okay? Because this cryotherapy, you're in there. Usually when people leave cryotherapy, usually they feel fantastic. Okay.
All the inflammation's been reduced.
Yes, because you've reduced inflammation. It's kind of that way you kind of set out fires. It also promotes that autophagy as well, because you have stressed the cells in a very short amount of time, right? So you've hit a lot of self-destruct buttons. So now people feel great. You will have a little bit of a detox reaction, okay? Now, because those cells have hit their self-destruct button, it's not going to create more inflammation. Like, we don't get a rebound, like I feel great, and then you get a rebound because now all these cells are releasing stuff. That's not what's supposed to happen. But people will feel better. Now, how long they feel better is different for everybody, depending on how much inflammation, right, how much autophagy we needed to stimulate. But cryotherapy is fantastic. It's a whole body therapy, a lot like hyperbaric oxygen. That's where it's different than laser and PEMF. Those are more, it's kind of harder to get the whole body, right? Like you can move those tools over around the body, but it takes some time versus, you're in cryo, you're doing it, right? And you're in a short amount of time. So, most folks, do well, with cryo, but you want to make sure that you are going someplace that will like walk you through the protocols, and you want somebody who's going to be there. Like usually they have a little window, and usually they have a tech or an attendant who's there with you the whole time. Okay, just in case something changes. Right. Yeah. Sometimes people can pass out with cryotherapy. And so you want to make sure, that there's somebody there, or like that they have a chair, or usually it's like a stool or something that you can sit on. Yeah. It's rare that happens, but sometimes when the body experiences that much stress and that quickly, if people have POTS, or if they have a blood pressure issue, we can see that as a side effect. So they should talk to you about that before you jump into their cryotherapy chamber. Okay. So it's kind of, I tell folks cryotherapy is kind of like when we talk about the hot. So mine's much milder, right? When we talk about the hot and cold therapy with the cold showers, it's kind of like you're doing that cold therapy on steroids when you're doing cryo.
Gotcha.
But can be very effective. It also does better with multiple sessions. So that's why you'll see in places who have a cryotherapy, they'll try to sell you packages, because the more often you go, the better you'll be in the long run. So, okay. I think that's most of the least invasive ones I have. So the ones that are a little bit more invasive are things where like they're poking you, right? Or like there's things that they're inserting into your body. Gotcha. So we'll start with IV therapies. So IV therapy is kind of a broad term. So in this regard, we're talking about IV therapy in relation to, or in respect to nutrients and minerals. Okay. So they do IV therapy. I mean, we do, if you've ever been in the hospital, right, or in the emergency room and they hook you up to a saline bag, technically that's IV therapy, right? They're putting something into your body. So that's why it's invasive. But there are different types of IVs that you can get. Usually for chronic situations, especially chronic inflammatory situations, I have people consider vitamin C, doing a vitamin C IV, where they're adding vitamin C to the bag along with the saline solution, can be very beneficial. Vitamin C naturally is anti-inflammatory, helps skin or connective tissue repair, as well as essential for, everybody knows, the immune system, but also our adrenals, right? So those things, it would make sense that they would be very helpful for a chronic inflammatory system situation. The high vitamin C, because it's antiviral, can be very helpful for chronic viral loads as well. Now, a lot of different nutrient therapy IV places will like give you a menu and let you kind of mix and match. If you want to do vitamin C is one I usually always have people do because it's pretty safe. Most people do well with vitamin C. Now, make sure that you eat before you go, especially, and get an IV therapy or at least a vitamin C, because it can kind of drop your blood sugar, so that you don't run that risk of passing out while you're in the chair. But you want them to do so. Usually they'll also push that vitamin C, depending on if it's like 250 mils or a 500 mil bag, but usually over like 20-30 minutes for a 250 mil bag, or over 500, like over 45 minutes to an hour. So you want to see that they'll tell you, oh, you may be here for an hour and a half, is what you'd like to see. So you can add other nutrients. So they have ones that have like on the menus where you can add like B vitamins, where you can add magnesium, where you can add other minerals, right? And so usually I have the easiest ones is the vitamin C, right? And so there are a lot of practitioners that may be the only one that they offer is just vitamin C IVs. But you can kind of mix and match depending on how you're feeling that day, right? And usually you can't go wrong if you're mixing with like B vitamins. We all need those, right? These are also the IVs that they can do for like weight loss or like enzymes, where they can add like a lipo shot to it, for fat burning. How effective those are, we don't really know, but yeah, you'll see them on the menu. But usually, like I said, you usually can't go wrong with vitamin C ones. Yeah.
Okay.
And then, yes. So sometimes even like when we're sick and we're not feeling well, sometimes it's just a dehydration issue is already a component of it. So sometimes just getting the IV therapy, just getting the rehydration, can be very beneficial. People can feel really well when they're rehydrated. Right? Yeah. So sometimes that can be very beneficial. Yeah. As well. And then if you're already there and you're, might as well add a little bit more nutrients, add a B complex and a vitamin C. Yeah.
Cool.
Okay. Okay. Ozone therapy is another one that's a little bit more invasive as well. So ozone, just like hyperbaric was increasing oxygen, but it was increasing it by like increasing the binding capacity, but still relying on ambient oxygen in the air. Ozone is you are adding oxygen to the body, right? So ozone is not very stable by itself. So it's usually you can create ozone, which I think is O3, where we think of oxygen, right, as O2. Mm-hmm. So they're adding oxygen molecules when they create ozone. And so you can, ozone by itself, right, if you like use ozone for like a lot of hunters will use ozone to like mask their smell when they're deer hunting. You can use ozone. They use it to kill mold on post. water damage. We use ozone in our body because it increases that oxygen, but it's just not stable on its own. So we have to ozonate something specific. So we either ozonate water, we can ozonate blood, or people can, you can ozonate in air. Okay, so there's different ways of doing it. So if you ozonate water, if you go to a place or a spa or whatever, and they're advertising we've got ozonated water or ozone, water. In water, it only lasts, I think it's 40 minutes before those O3 molecules will split and attach, right, to make more H2O, just because that O3 is not stable. You can, in some clinics, they will draw your blood. They'll take your blood in a vial and they will ozonate your blood. Okay. And then they will inject it back into you. So then the ozone particles are in the medium of your blood or serum, probably serum, or plasma, and then they inject it back into you. When they inject it back into you, again, those ozone molecules will disassociate, if you will, and then they are released into your body. They will bind to your red blood cells, right? More ozone more oxygen decreases inflammation, promotes healing, right? Stimulates new cells to grow. And then you can do ozone sufflations, right? Most of the ozone sufflations I've seen have been rectal sufflations. So they will pump ozonated air into a bag and seal it. And then oftentimes the doctor's office, it'll have an attachment that looks like an enema attachment, or it'll look like a douche attachment. It's the same thing. And then they will give people the opportunity to insert that sufflation, whether it's a vaginal sufflation of ozone or rectal sufflation of ozone. Now, oftentimes when they're doing that, they're targeting something specific. You can still, when oxygen is oxygen, right? And you increase oxygen into the body, it's still going to do what it needs to do. It's still going to always decrease inflammation, right? Promote that healing and stimulate cell repair. Oftentimes, what I see when they're doing it vaginally is we're trying to address like fibroids or endometriosis, right? Or like things with cervical changes. But eventually it's going to get into the bloodstream. And then the same thing with rectal sufflations. Now, because the rectum has a much dense capillary system, there's a lot of blood supply there. So things absorb into that capillary system a lot easier. So that's usually why they aim for like a rectal sufflation, because you'll get into the bloodstream faster, and then they're not like, it's still invasive because you're inserting something in you, but it's less invasive than, right, like removing blood and putting blood back in.
Gotcha.
So that can be, beneficial as well, and trying to like kickstart, the reduction of that inflammatory process, right? We're trying to, again, like raise that threshold so that our immune system isn't so reactive, and just, right, kind of stimulating that regulation, or like turning that off switch, if you will, so that those cells aren't continuing to increase inflammation and send out those chemical signals that, bring more inflammatory cells.
Cool.
Yeah. And then, does that make sense?
Yeah.
Okay, one more. This one I'm not as adept about, to be honest, but there is a therapy that's called exosomes. And I don't know any practitioners in Oklahoma who offer this, but I know that they're, and the ones that I know are in Arizona and California. But there could be practitioners in Oklahoma that offer this, maybe like regenerative medicine or anti-aging type medicine. So exosomes are a type of enzyme, okay? And they go around and really like destroy inflammatory cells, okay? They kind of go through and like they're using them for a lot of pretty much anything with chronic illness, right? From blood pressure, heart disease, to diabetes, to cancer, autoimmune conditions. And it's not an IV therapy, it's a injection. And oftentimes it's not, you can do it systemic, but oftentimes it's an injection into a specific area as well, if they know like what area they want to treat. So you can use exosomes for like joint pain and things like that, but systemic, it is just injected. And it's kind of like you're this is not the best description, but in my mind, it's kind of like you're sending in all these little, like, very targeted little Pac-Man to go in and look for those inflammatory cells, right? Mm-hmm. This is a very new therapy, like new within the last 2 or 3 years. So that's why I say there's not as many practitioners who are doing it. If you find a practitioner who's offering exosome therapy, ask a lot of questions. Ask them how long they've been doing it, where they were trained. Like, you really want to feel like they've got that confidence. Yeah. And ask them like what their cases look like. What have they seen? You know, what kind of changes have they seen in people with exosome therapy? Before you kind of, explore that. Really kind of do your homework on that particular practitioner and their level of proficiency with that therapy. Yeah. So, but yes, I've seen it to be very effective. It does have some really good case studies and a little bit of research behind it in really like decreasing inflammation, right? And really kind of changing things around for people. It's getting a little bit more popular again in kind of the anti-aging world. And so that's why there's like more and more people are offering it and training on exosome therapy. So something to keep an eye out for and see if,
So you can, I think you're probably gonna have to answer this question probably from a political stance. So if there's no one in my business mind, if there's no one in the state of Oklahoma doing that, is the reason that you're not doing it because of the licensure stuff here in the state of Oklahoma? Or like, why haven't you done it? Like, if it's a market and it works and like there's no one here with it, like.
Yes. So so my scope of practice does limit me in the state of Oklahoma, where I can't offer invasive therapies.
Gotcha.
So anything that's injection, anything that's inserting a needle, so like so the IV therapy I can't offer, exosomes I can't offer. The ozone would be a little bit tricky. So this is how I could be able to offer it, is if I had an ozone machine, is that I could do the rectal sufflations, right? But I'm not doing them. So I would fill up a bag with ozone, put the adapter on it, give you the instructions, leave the room, and give you the option. Is this something, if this is something that you would like to use, right? Like, it's good for 30 minutes, fantastic. If not, just leave it on the table, right? That's so, but I can't draw blood, ozonate plasma, and re-inject it into the system. Yeah.
Which is so interesting, because in the state of Oklahoma, people that what is below an RN? I don't mean to be disrespectful in that, but like LPNs can do that, and that is
so right? LPNs can do that, but they are overseen by a doctor, with a license that has the scope to do that.
But like, could RNs do that?
Yes, this is where it gets tricky. RNs technically can give injections and do IV therapy without a overseer, without somebody with another
license. Super interesting state of Oklahoma.
Yes,
like that, and that an RN is not even a bachelor's degree, is it?
Oh no, now they are.
Now they are.
Well, I think you have two options. There's associates in nursing, and then usually a bachelor's in nursing. And I don't know if the regulations changed in Oklahoma, if now everybody has to. I think they still have both programs.
Yeah. And then here you are with 4 years of medical school, and they're like, yeah, no. And I'm not trying to be disrespectful to people that are LPNs or RNs. It's just, that's infuriating, right? Like, it should be if we're saying that these people are competent enough to do it, then obviously people that have gone into 4 years of med school, whether it's naturopathic or conventional, are competent to do that as well.
Right. That's where it does get frustrating. Yeah. When they're kind of limiting that scope of practice. And so that's also part of the reason why the therapies that I offer in my office, I try to choose therapies that I know that are going to be effective and that are whole body therapies, right?
Mhm.
So it also helps with a person's time, right? Where they're getting kind of the biggest bang for their buck. So yeah, it's one of those things I've kind of just gotten used to, but it is frustrating.
Well, for a patient, it's frustrating, right? Like, what? Because that puts me in a situation where I either have to go find it illegally, or I have to cross borders to do it, right?
You've got to go out of state. Yeah.
So cool. All right. Anything else?
I don't think so. I think that was a pretty good overview as to some alternatives.
All right. Thank you, Dr. Carmen.